Good afternoon. Thank you for being out here. My name is B.J. Lawson, congressional candidate in North Carolina's 4th District. And I have a really intimate knowledge and experience with, and frankly, heart for our healthcare system. I was a physician by training. I left a neurosurgical residency at Duke in 2001 to start a hospital software company. And one of the reasons I left residency because I was extremely disturbed about what I saw as some fundamental flaws within our healthcare system. And I was looking for an opportunity to actually help improve the system from the outside. But I've come to realize that the forces that are being arrayed against our healthcare system have never been more dangerous or more effectively deployed against what we should really care about, which is the doctor-patient or the provider-patient relationship. And I'm very honest when I talk to people about healthcare. I say our American healthcare system works great unless you're a patient or a doctor. And that's kind of the unfortunate truth, because we need healthcare reform. We need a free market for healthcare. We need to empower patients and we need to empower providers. But what we're doing with this legislation, what we've done with this legislation, is we have taken ourselves down a path of destroying what remains of the American healthcare system. And I'll just give a brief anecdote from my personal experience. When we were growing our software company, we provided healthcare benefits to our employees. And after our software company was acquired and I ended up leaving our corporate parent to go into business for myself again, I began to shop around and try to figure out how I was going to get the same coverage that I had been given by my employer. We had an 80-20 plan. My wife and I have 3 kids. We have a family of 5. And I began to realize when I was shopping around that our healthcare premium for an 80-20 plan was going to cost $20,000 per year before I'd even seen a doctor. We could be completely healthy and I was going to have to pay $20,000 a year. That didn't work. Couldn't afford that. So then I started to do some more digging and I began to realize, okay, there's this thing called a healthcare savings account, and I can get a healthcare plan, an insurance plan with a high deductible. Now granted, this is a really high deductible, $10,000. So I would have to pay all of our family's medical expenses cash out of our healthcare savings account up to $10,000, but once you hit $10,000, everything's covered. Well gosh, how much does that cost? Well, that was only $300 a month, $3,600 a year. So for 6 months worth of premiums, $10,000, I put that into a healthcare savings account, and then I have insurance for anything above $10,000. I can sleep well at night. Our kids are protected. That makes sense. And that's what we have done over the past 6 years. And it's worked pretty well. Now granted, what started out as $300 a month is now $350 a month. Yes, inflation is still rearing its ugly head. But you begin to then realize that even that's not a perfect world, because when something happens, as I was trying to take a rusty license plate off an old truck, the pliers slipped and I cut my finger, and I needed stitches. I had a pretty long gash in my finger. Then I'm calling around different urgent care places, fingers wrapped up in a rag, and I'm saying, hey, how much to stitch up a 2-centimeter laceration? Now granted, anyone could have, laceration, fancy word, but anyone could have made that phone call and started to shop around. But you know what? No one could tell me. No one has any idea what things cost, right? So what we begin to quickly realize, if you look at our healthcare system today, we have nothing resembling a free market for healthcare. Our American healthcare system today is, in fact, a centrally planned, might as well be Soviet communist system, where the federal government in Washington, through its Medicare fee schedule, A, they determine what healthcare is, based on assigning it a CPT code or a billing code for a doctor, and B, they determine what it's going to cost because they actually publish a fee schedule. And your private insurers, they might adjust those numbers up a little bit depending on how well the doctors bargain, but at the end of the day, it's a centrally planned, centrally managed healthcare economy. When I'm calling around to the urgent care centers, I'm not running into anyone, or I wasn't running into anyone at the time, who could tell me, oh yeah, there's a special today, we'll stitch up for 120 bucks, or 50 bucks, or 75. I don't know, but that's what we need. And when you do need to go to the hospital, when you have a heart attack, when you have a stroke, if you need to, God forbid, see a neurosurgeon, that's why we need good, affordable, catastrophic health insurance, right? And there's a difference, because when I'm responsible for my first $10,000 of out-of-pocket expenses, yes, there is rationing of healthcare involved at the Lawson family. But who's doing the rationing? My wife and I. And we're very focused on staying well, staying healthy. We don't go to the doctor every time we have a sniffle because we know it's expensive. So to move in a direction of freedom, to move in the direction of free markets, really requires that we start to educate folks that, first and foremost, our government cannot and does not and will never provide health care, right?